as I mentioned, the Spring Festival travel rush is right upon us. Over 2 billion people will be traveling during the Spring Festival rush. I guess our next focus will be turning to those primary level healthcare centers. Now let's go to Dr. Wang again. Dr. Wang, tell us, what is the role of primary level healthcare centers play in this fight against COVID right now?
Okay, I think for our medical staff working in the primary medical center, it's important. It is very important. First, they need to have plenty of the medication ready. So, such as the medication for cough and the medication for the fever, and even the anti-COVID virus medication ready. So it is very important. So second, I think they need to pay more attention on the patients who have high risk for developing severe complications after catching the COVID-19. So also they should learn to distinguish the symptoms of critical early COVID cases. So they can try to figure out who are in critical situation, who are not. So for those patients with in critical situation, so they need to contact to the tertiary hospital or bigger hospitals. So in order to transfer these patients to higher level of medical center as soon as possible. Third, I think also they are one responsibilities is to provide supply the patient education about the COVID. Now also they need to inspire their community members to have the COVID vaccination, especially among the senior patients or patients with high risk, like the high risk factors, like the diabetic patients or the obesity patients.
That's very important. We already formed a partnership with more than 30 hospitals, for example, primary care centers and also some clinics in the countryside. And due to the surge of the COVID-19 infection, we have to recruit more medical staffs to provide care for our patients. For example, other specialists, including orthopedics, surgeons, and maybe even like OBGY physicians. So the first education is very important, to teach them how to treat with COVID-19 infection. So we provide online training sessions for those medical staffs, which benefit more than 700 medical staff in our partner hospitals. And second, we already built up a very robust telemedicine system, so we can provide telemedicine or consultation for our partners if they have difficult cases. For example, reading of the chest X-ray and how to use the medications. We can provide all kinds of this service to them. And also, if they have a very severe patient and need to referral to a hospital, we can also give them a green pass, a so-called green pass. And third, we have 7 close partnerships in the countryside in our province. We dispatched 12 to 13 physicians to each of these hospitals to work on site and give them support and also help them to care our COVID-19 patients. So that's very important to increase their capability, to manage this kind of patients, especially the critical patients.